Did you know that Down syndrome occurs in approximately 1 in every 700 live births globally? Individuals with Down syndrome are known for their infectious smiles, loving personalities, and remarkable resilience. Today on Medical Matters, we dive into gaining a deeper understanding of this genetic condition. Ongoing research into Down syndrome continues to unveil crucial insights into the brain and genetic makeup.
Down syndrome is a genetic abnormality due to an extra chromosome, in fact, chromosome 21. The other name is trisomy 21, and it is actually a compilation of features that basically is named after the doctor who first described it more than 100 years ago, Dr. Langdon Down.
According to the World Health Organization, age plays a significant role in the development of Down syndrome. Women aged 35 and older at the time of conception have a higher risk of having a baby with Down syndrome. But here's the twist. Even men over the age of 40 face increased risks too.
When fertilization happens, there's the extra chromosome. And it's not something that anyone did during the pregnancy. The features is basically facial features. The eyes slant slightly upwards, the nasal bridge is flat, children tend to be short, have other hand and foot features. So those features is what Dr. Down described. But then subsequently we know now what is the cause.
And how is Down syndrome diagnosed?
So after birth, Down syndrome is diagnosed by taking a blood sample and basically counting the chromosomes. Now, we normally have 46 chromosomes, 23 coming from the mother, 23 coming from the father, and they can count, is there an extra chromosome or not, by doing specific genetic testing. During pregnancy, you can take the fluid around the baby or other material from the baby and do exactly the same tests.
Additional genetic material leads to the distinctive features and developmental challenges associated with Down syndrome.
So there's different types of Down syndrome. There's one, and the most common one, you have just a separate extra chromosome. There's a type called the translocation Down syndrome, where the one extra chromosome is attached to another chromosome. And then we do see variation in the presentation of Down syndrome. There is a type called the mosaic Down syndrome, which is less severe, but even in a subtype, even the normal non-disjunction type, the more common type, you can have different variation, especially in the degree of intellectual and learning problems.
Individuals with Down syndrome may experience a range of health complications, some of which may become more noticeable as they age.
Around about 50% of children with Down syndrome have heart defects, which basically in a lot of cases will need a heart operation to repair. So that is, I think, the most dire complication. The other complications is your learning problems, and then certain blood conditions like an underactive thyroid, and there's a slightly increased risk for blood cancer, leukemia.
The passing of Down syndrome from parent to child isn't common, but it is possible.
If in some cases one of the parents already have that abnormality, they are called balanced translocation carrier, and in those cases we call it hereditary because the parents already have the abnormality. They obviously don't have an extra number 1 chromosome, but the risk for recurrence in the next pregnancy will then be increased.
It's evident that awareness and understanding are key to supporting individuals with this condition and their families. Let us continue to create a more inclusive and supportive environment to enhance the quality of life for all. Until next time, take care.